Hello, everybody. My name is Peter Peliquin. I'm a third-year resident in emergency medicine at Maimonides Medical Center. I'm currently doing my selective rotation in wellness, which has given me an opportunity to examine exactly how we work and why there seems to be certain difficulties involved with our job and all shift workers that tend to make what we do especially difficult, rewarding, but difficult. And this is a presentation essentially on how we struggle with shift work and our circadian rhythms and the interplay between the two of them. So we all know people who are beautiful. Are they good looking? Yes, but that's not exactly what I'm talking about. They are beautiful because their lives seem beautiful. When we struggle home and walk home from a night shift, and at 8 in the morning they're seeming tired as they drink their perfect-looking cappuccino or Starbucks, and you can hear them complaining how early it is, those are the people I'm talking about. The people in the bars on Monday nights, even when fantasy football is uninvolved or when Monday Night Football is uninvolved, these are the people I'm talking about. They're usually tall. They usually have nice teeth too, but not necessarily. Yep, this is another picture of what they might look like. They probably dress up for Halloween in excellent, perfect costumes. That guy's there too. And then there's us. We just don't look as good. We're often about to fall asleep or sleeping in public on subways, making it very easy to take fun pictures of our coworkers, but often we look like zombies or almost zombies. So why do we look like zombies? Is it because our jobs are stressful? Is it because we work too much? Is it because we're isolated from working too much or having stressful jobs? Or is it we just eat poorly? Or are we all on drugs? Why do we look like zombies? Well, I think it's a little bit of a combination between all of these, and also that we enjoy and are employed in shift work as emergency medicine physicians. Now, even the American College of Emergency Physicians has on their website a quote suggesting that shift work is particularly responsible for some of the difficulties we find in our field. The quote is, "The adverse effect of constantly rotating shifts is the single most important reason given for premature attrition from the field." Yikes! But I think it's true, and I'll tell you why soon. So shift work generally characterized as anything that is not a 9-to-5 job. So there's some pros and cons. There's a reason why we have shift work. Pretty much no one wants to work night shifts all the time. If they did, this probably wouldn't be that much of a problem. But even the people who work night shifts need breaks. So shift work gives us flexibility, autonomy. Often there's less specialists working and less bosses working in the emergency room at night or on off hours, so it gives us some autonomy. There's often, by working shifts, we actually have a reduced workload in general compared to certain specialties that are having to be in the hospital during 24-hour calls or 30-hour shifts or something like that. And often people tend to work in shifts because the wages are better. Sometimes there's a night differential for people who just work night shifts or for people who are more flexible to bouncing back and forth. However, there are lots of cons, lots of things that people don't like. People cite exhaustion, irritability, depression, even GI problems seem to be worse in people who are shift workers who flip back and forth between nights and days. And people also cite social problems. You can even break these problems down into biological and social problems. On the left there, you see some problems that seem to be almost biological in nature. They have to do with our GI problems, or we seem to get sick more. And socially, we may feel isolated. We may feel even a little uncool. And I want to try to talk about how most of these are due to disturbances in our circadian rhythm. Particularly being possibly not as cool as we used to be. I think we can all remember when there was a time before medical school, possibly, when we were able to talk about world politics or things that weren't medicine in a very nonchalant and engaging manner. And I think you and I both know that now that when we meet with those certain friends, it's almost like we struggle to re-engage with society. And this isn't just because we've crammed our heads full of medical knowledge, but I think it's actually a result of us working strange hours in an irregular manner. So circadian rhythm, what does it actually mean? It's pretty much thought of as any biological process that oscillates around a roughly 24-hour schedule. Circa meaning around, dia meaning day in Latin. Hippocrates, actually in around 400 BC, was one of the first philosophers to consider anything with the body having a rhythm of sorts. He actually likened it to kind of a celestial pattern, planetary type of patterns that would be seen and related fevers. The first thing he thought that was cyclical was fevers. He thought there was a quotient, a tertian, and a quaternary stage of fevers. Later, Aristotle also thought that there was some cyclical patterns to the human biology. He even felt that sleep was caused by eating. The food would then be in our stomach. Vapors from the food would rise into our brain, which they would then condense. That condensed food vapor water would then run into our heart. Our heart, being the sensate organ, at least that's what he thought, would then fall asleep with the vaporized food water. Even though he might be completely wrong and make no sense, he thought that that is why we sleep after eating, or we're tired after eating, almost in a cyclical manner. So I thought this was a pretty good diagram of just some of the more respected circadian rhythms and patterns of our daily life that we go through. If you see here, almost at 6 in the morning, on the left-hand side, that's essentially when we're supposed to wake up, according to this chart. And right away, we have circadian rhythms at work. Our blood pressure is highest right around 7 a.m. in the morning. Our melatonin secretion stops regularly right around that time. Melatonin is involved with sleep, and with the cessation of that, we're supposed to be more awake. Most people have a bowel movement right afterwards, so on and so forth. Throughout the day, we have different peaks and troughs of our abilities, of our reaction times, of our alertness, of our vital signs, all the way throughout the day. Again, some of the more accepted ones are alertness, vital signs, heart rate, even respiratory rate, blood pressure, everything like that seems to follow a daily rhythm. Hormone biosynthesis and gene expression have also been shown to follow a 24-hour period of peaks and troughs in expression and synthesis. And again, digestive patterns and immune responses also appear to follow a type of pattern. So what controls these patterns? Generally speaking, it seems like there are endogenous controls and exogenous controls, inside and outside. In terms of our endogenous controls, the suprachiasmatic nucleus, which is found at the base of our hypothalamus, appears to control from the inside via gene and hormonal expression most of our circadian rhythms. However, that is not the only thing. There's also exogenous controls, something that the Germans have called Zeitgebers, time givers. These include light, temperature, social interactions, eating, drinking, pharmacological manipulation, exercise, all things on the outside that have things to do with our rhythms. A good example of how they determined that there were inside and outside causes and manipulations and controls of our circadian rhythm is by looking at body temperature. Body temperature almost uniformly in a normal person occurs at about 7 p.m. The max temperature, the highest temperature of the day, most people around 7 p.m. Some studies say 4 p.m., but we'll call 7 p.m. To determine whether or not there was actually an internal mechanism for keeping the body honest and having the temperature be highest at 7 p.m., experimenters took people and essentially made them bedbound so that they didn't walk, they didn't converse with anybody either, had them sit in bed all day long, and even while sitting in bed all day long, they still found that their max temperature was also at 7 p.m., showing that even without these Zeitgebers, these outside exogenous influences, people still continue to have circadian rhythms that seem to be based on an internal clock, essentially showing that there was some internal mechanism, and it's the suprachiasmatic nucleus controlling these rhythms. Of interest, for the person who wasn't bedbound, the normal person who was eating, drinking, talking to people all day long, storing up energy, their body temperature was actually even higher at 7 p.m. than was the person who was bedbound, showing that there's probably a synergistic effect of the endogenous and exogenous, which is what this diagram shows. Essentially, you have somebody here whose suprachiasmatic nucleus is contributing positively to a circadian rhythm, as are the Zeitgebers. And this when these match up correctly, when both the exogenous and endogenous controls contribute positively, it leads to a positive experience. And here you have a nice, happy doctor. He's very happy. She's probably not a doctor. She's super well rested. She could be a resident, or maybe a medicine resident, maybe a med student. I don't know. Probably a model. Probably a model. But doesn't matter, because what I'm going to tell you next is when things go wrong, how do they go wrong? Exactly how do circadian rhythms adversely affect shift workers, which is really my point. So here's the point. You get discordance when you have your endogenous, your suprachiasmatic nucleus, who's trying to push you in one direction for these circadian rhythms, and it fights against the exogenous, the Zeitgebers. And that is when you get trouble. Specifically, when you have circadian rhythms, when you have circadian rhythms produced from the suprachiasmatic nucleus, and it's giving you one symbol, but instead of now, let's say you're normally sleep at night, let's say now you sleep during the day and you work at night, this gives conflicting signals to your body, and you now get some type of discordance, and it makes you unhappy. You are now an unhappy shift worker. Again, you have conflicting signals. Life really does stink. So let's say your max temperature is at 7 p.m. That's what your suprachiasmatic nucleus wants you to do, but now you're working the night shift, and you're just acting totally strange during the day. You're sleeping all day. You're not eating. You're not talking to anybody all day. You're not drinking coffee. And so now all those exogenous forces, which were contributing to their version of the increased temperature at 7 p.m., those aren't there, and you're fighting against your suprachiasmatic nucleus, and this is gross. This makes this guy. Essentially, it makes jet lag, and it just makes you feel terrible. And jet lag sounds very innocuous, but anybody who's worked with bad jet lag knows that you feel terrible, and you are essentially possibly not even safe to see patients sometimes. You can feel constipation, irritability, acid reflux. I personally get really bad acid reflux when I work back and forth days and nights. People are hungry. People are depressed and in coordination. I actually remember, in terms of being incoordinated, I remember lack of coordination, probably around 4 a.m., right when I was really feeling tired. I thought that really was the worst of my circumstance at that time, when I had a patient come in with a complicated laceration, and I could tell that my coordination was not as good, and the LEC took twice as long for that reason. It was almost like they weren't my hands. So, unfortunately, that's not all what makes our life difficult. It's not just that we have discordant circadian rhythms that makes us feel so sad. What about sleep and our social lives? And let me tell you, there's trouble with those. Okay, so an overview on sleep. Let's start there. First, we have non-REM sleep versus REM sleep. Those are the two main categories of sleep. Non-REM sleep can be broken down into 3 primary stages. The first stage is a drowsy type sleep. It's a type of sleep where most people don't even think they're sleeping at that time. You can have myoclonic jerks. You can have hypnagogic hallucinations during this time, on which you jolt and jump out of bed. That's all during non-REM stage 1 sleep, where you have alpha and theta waves. Stage 2 of non-REM is actually the stage of sleep where we have the majority of sleep is during stage 2. We have a different waveform seen on EEG. You're completely unconscious during this time, and it's actually a pretty poorly understood stage of sleep, but it is known that it's not essential. This is the stage of sleep that you get when you drink too much, or you take like a benzodiazepine or something like that for anxiety, or a sleeping pill. It is not a restorative type of sleep. People who get a lot of this type of sleep from these sleeping pills or alcohol or something else don't actually enjoy the benefits of a good night's rest, which comes next. Stages 3 and 4 of non-REM sleep, the slow wave sleep. This is when people start feeling better. These are the parts of sleep that's important. You have growth hormone secretion, bodily repair mechanisms are going on, and this continues, in REM sleep, actual REM sleep, which is known as paradoxical sleep, because the brain, although you're deeply unconscious and you're hard to arouse, is most active. You use the most oxygen during this part of sleep, and you have most visual dreams during this part of sleep. In a typical hypnogram, you can see these stages of sleep represented on this graph. We start being awake, and then we quickly go to stage 1, stage 2, stage 3 in the first part of the night, let's say maybe around midnight. And then every hour and a half, these stages of sleep pretty much repeat themselves, with the first dose of REM sleep occurring maybe about an hour and a half after we've fallen asleep. And then cyclically, you see REM sleep occur almost with a greater influence towards the end of the night. As you can see, sort of at the end of the night, there's a greater occurrence of REM sleep and stage 2 sleep. And this is important, and I'll tell you why soon. So this is just kind of a reading from some electrodes that were placed near people's eyes. This is how REM sleep got its name, for rapid eye movement. This is the rapid eye movement chunk that people see. During REM sleep, again, there's increased brain activity and oxygen consumption. It's actually very much like being awake. You're difficult to arouse. You have vivid dreams. In fact, you're paralyzed, which a lot of sleep pathologists believe is important to be paralyzed during this time of sleep. Otherwise, you maybe will act on your vivid dreams, which is probably not a good thing. Okay, enough about REM sleep. So how does this affect shift workers? So shift worker sleep patterns are generally erratic. Shift workers also sometimes suffer with a bright or noisy environment. They're often interrupted from people who don't work shifts, who are calling them in the middle of the day. But importantly, their sleep during days, when they're working nights, these shift workers have less daytime sleep on average by 1 or 2 hours, usually 2 hours. And also, that corresponds to a decrease in REM and stage 2 loss. So see you later, REM or REM. It's a mediocre joke. I'm going to take it. I'm taking it to the bank. Thank you very much. I'm at the bank. Again, shift workers are working 2 hours less. And what happens when you work that 2 hours less is that you lose out on some REM sleep. Now, again, before I spoke about how stages 3 and 4 of the non-REM sleep have been shown to be restorative, but what does REM deprivation show? And here's what it shows. Generally speaking, it shows that people who don't have REM, a sufficient amount of REM sleep, have impaired complex task learning. This was originally demonstrated in children who have a majority REM sleeping pattern. They have more REM than we do. And that children who are deprived of this REM type sleep have lower social skills, they have decreased mental capacity, and essentially struggle maturing. In shift workers, this has been shown, decreased REM, to have people have increased irritability, anxiety, and aggressive behavior can increase. And just as a personal example, I'm still here, I'm still a doctor, but I've definitely made mistakes. Maybe 2 times in all of residency did I lose my cool. And they occurred on the 5th or 6th overnight in a row, where I became unusually upset at essentially a typical occurrence in the emergency room, family members asking for results who were as pushy as always, but I lost my cool 2 times, and looking back, they were both during times when I was not sleeping adequately on night shifts. Some people describe appetite increasing when they lose REM sleep. And researchers have actually even shown that even though there's a classical benefit of having stages 3 and 4 of the non-REM sleep in terms of brain cognition and functionality, the brain, when it does lose REM sleep, the body then, when it has an opportunity, supplements by having an unusual amount of make-up REM sleep, as in it tries to replace it. And so researchers attribute that to as an importance why people need REM sleep, because the body is trying to get it more. Okay, so here we know that circadian rhythms are discordant in shift workers. We know that sleep is of poor quality and it's shortened, and that makes it of poor quality as well. What about our social lives? Here they are. Beautiful family. Is society against us too? Is there nothing good? Is that guy, the next door neighbor, mowing the lawn? Or does that even represent us not doing a chore that we were trying to do because we're working these shifts of weird hours? Our cell phone rings when we're trying to sleep at night. Our dogs and cats don't understand that we're trying to sleep. They think it's fun time, and they walk all over us when we sleep. That contributes to poor sleep and poor living. Our friends, remember when we used to have that many friends, in a pack of friends like that? I haven't been in a pack of friends like that since high school. Well, now they're my fantasy football friends, but that's not a big deal. I still miss those guys. We're not beautiful people anymore. What about our romance? That everybody knows that goes away. Travel, we used to travel all the time. Is that gone too? And what about our hobbies? What about even watching the World Cup? I'm a huge soccer player. I used to play soccer in Europe. Didn't get to watch one game last year. All these things can stress us out. In fact, data shows that shift workers have harder lives. We have increased divorce rates. We have less marital satisfaction when we are married. There's a higher suicide rate, higher rates of substance abuse and depression. In fact, we're even dangerous people in society. And the Exxon Valdez spill, 3 Mile Island, the Bhopal chemical plant explosion, Chernobyl, all of those things occurred on the night shift. Some resonant quotes that I recently heard in my ED. I wake up tired and go to bed wide awake. Without sleep, we become tall 2-year-olds. That was a quote from a pediatric ED resident. And I think my favorite one is, I know I am missing out on my life, but I don't even know where to look for it. So what can we do? Are we destined to suffer? Is that our lot in life? Is that what we signed up for? Well, all right. So here's some quick tips. And I don't promise to fix everything, but these are just some quick tips based on research that can make life at least a little bit better. Okay. So the first thing we need to do is sit down our significant other, if you have one, or sit down your close family and just educate them. Educate them that shift work, not just emergency medicine, not just being a doctor is difficult, but shift work. We're going to not make family events, sure. But sometimes we're not going to make those family events not just because we have to work, but because we just need to sleep. Or we have to do the laundry. Or we have to go grocery shopping. Basic stuff will always be there. And yes, your friends are going to be bored out of their minds, but you have to actually tell them this. You have to tell them why you can't do it, or otherwise they're going to stop being your friend, and you don't want to lose any more friends. You have to help them help you. Never rotate shifts, as in always work day shifts. That would be great, but unfortunately, this is not really a possibility. I mean, ideally, you would work only nights or you work only days, but that's not really a possibility. So what we can do when we have to work nights, if you are someone who works the days and has to work nights occasionally, which is most of us, your job is to work as few nights in a row as possible. This avoids circadian discordance to a max. It takes around 4 to 7 days for your circadian rhythms internally to change and match up with your external, your Zeitgebers. So the recommendations from multiple different sources are that we try to work 1 night shift or 2 in a row and then go back to days, not 4 to 7, as best we can. Again, this might not be possible, but try to aim for that. Shorter shifts have also been shown to allow us to recover circadian rhythms quicker than working longer shifts. And when we do have to switch to nights and we have to sleep during the day, get blackout curtains, make it a cool, dark, quiet sleeping space as best you can. Cool is an interesting part. Research shows that most people sleep best between 60 and 70 degrees Fahrenheit. Okay, other things that we can do. People often engage in what's called anchor sleep to try to decrease the effects of circadian rhythm discordance. And what I mean by this, anchor sleep is when let's say you're working overnights and you normally sleep or you normally work from 7 p.m. to 7 a.m. on a night that you're not working, but you're still going to have to be on the night schedule. Don't try to switch onto a day schedule. Don't try to switch your body into sleeping at nights now and being awake during the day. Go to bed late. Go to bed at like 3 or 4 in the morning as if you were working. And then this allows you to continue your circadian rhythm, continue what you've been doing while getting some extra day hours in there so you're not a total zombie and you can hang out with your friends a little bit. Split sleep. This involves when people come home from a night shift and they sleep 3 or 4 hours, then wake up so they can enjoy some of the day, and then sleep another 3 hours before going back to work. That first chunk of sleep after you get home actually is thought to be more beneficial because it's still part of that circadian rhythm of sleeping at night that you're missing out on. And this essentially halves or 50% benefit from just sleeping throughout the whole day. In naps in general, if you don't need a nap, don't take a nap. It just gives the bodies the wrong signals and can lead to some discordance as well. Exercise. Exercise, everybody tries to do. It's really hard to do during residency or being an attending. But if you can exercise right when you wake up. And that can be right when you wake up at 6 p.m. at night before going on a night shift, or right when you wake up in the morning before a day shift, that has been shown to increase alertness and to better align our circadian rhythms as well. Now, bright lights look pretty boring, but in many different sleep studies for the last 50 years, bright lights, artificial lights, fine, just bright light right in your room right there, can help you wake up. This can help improve alertness upon waking up and can essentially improve correlating your circadian rhythms to whatever schedule you would like. Even if you need to put those bright lights on you at 4 in the morning, 10 in the morning, use bright lights. They help. Common question is, and a common thought is really, how can I quickly self-medicate and fix my tiredness based on my shift work, my sleepiness problems? General recommendations. Even though it's tempting, when we're tired and we think we need to sleep, a warm beer sounds really nice. And it is delicious, and there's no question about it. However, it won't give you the sleep you want. Remember, alcohol, sedatives, and hypnotics, they might make you fall asleep, but they're not giving you the sleep you want. They're giving you stage 2 sleep, which is not a restorative type of sleep. Caffeine, among all the general recommendations, is pretty much the most supported for getting the opposite effect, actually enabling you to to become more alert during shifts. Although it's not really recommended towards the end of a night shift or day shift if you're going to go to sleep about 3 or 4 hours afterwards. Opioid use has been shown to be helpful in helping people sleep who are in pain, but otherwise the results are pretty controversial. And stimulants and amphetamines are not really recommended, except for this one. There is some evidence that modafinil, which is in the amphetamine family, does have a significant role in increasing alertness, even better than 500, 600 milligrams of caffeine, with the benefits that it doesn't have a very high abuse potential and also has a low side effect profile. There's still ongoing research with this, but there is some promising results so far. For the other end of the spectrum, melatonin and pharmacological melatonin, an analog of the endogenous hormone that's secreted from the pineal gland, has been shown to improve jet lag and help reset circadian rhythms, although there was a large study done in 2005 that showed that it actually, there wasn't clear benefit in shift workers. Most people anecdotally have seen that melatonin can be helpful at low doses, and also there's a low side effect profile. Okay, so in summary, shift work. It's scientifically and socially difficult. Socially, we know. We used to be beautiful people. Maybe we never were, but we see them now, and it's hard. It's hard to do that. And don't say it's not hard. Don't tell people this is easy. This is not. And scientifically, it shows that we're more depressed. We have acid reflux. We've got problems. So don't make it worse for yourself. Communicate with family and friends. That's the most important thing you can do. You don't need to be the completely whining doctor, but you're allowed to remind people that your life is totally different than theirs right now, and that you're going to do everything you can to make it work, but use them. Have them help you. Arrange shifts and sleeping habits with your circadian rhythms in mind. You might not be in a position where you're able to do this, but if you can, again, try not to have many night shifts in a row unless you're going to work several weeks of nights, and try to avoid flip-flopping as best as possible between night and day shifts. If you can use lights and exercise, that will help you readjust and realign your circadian rhythms to whatever time you want. It's been shown to be, they both have been shown to be very helpful in this effect. And if you need to use any medication, start at a low dose of whatever you're using, and only use it as necessary. Be very well. I wish you all lots of luck. I hope there was something in this lecture that you can take home and use to benefit your lives. Thank you, guys. Bye-bye.